Today we will be demonstrating how to complete the intraoral examination. Please note that this video has been sped up for teaching purposes. When performing an intraoral exam in clinic, make sure to be thorough and take your time. An intraoral exam should be performed on every patient in our clinic as a cancer screening and also to establish a patient's baseline anatomy and oral conditions. Prior to starting the intraoral examination, you need to have the necessary armamentarium, which includes PPE, a mouth mirror, a probe, 2x2 gauze, a cotton roll with petroleum, a cotton swab, and a patient bib. Have patient use pre-procedural antimicrobial rinse. Provide patients with protective glasses, bib, and petroleum jelly for their lips. Place patient in supine position with appropriate overhead lighting. Unwrap sterile instruments. Perform initial general inspection intraorally with mouth mirror prior to sequencing. Begin examination with the lips. Visually check the vermilion border. Use bidigital palpation to feel the circumference of upper and lower lips with a rolling motion, and gently stretch lips away from teeth to examine the labial mucosa. Next, pull cheeks out to visually inspect buccal mucosa and to bidigitally palpate with circular compressions. Dry the parotid gland with gauze and observe salivary flow. Also use a cotton swab to stimulate the parotid gland. Retract mucosa to visually inspect and digitally palpate the vestibular area, gingiva, maxillary tuberosity, and retromolar pads. Visually inspect palatal region with mouth mirror using reflective illumination from the mirror. Digitally palpate hard and soft palate. Visually inspect the pharyngeal area by instructing patient to extend their tongue and gently place mirror, the mirror side down on tongue, and ask patient to say, ah. Instruct patient to slightly extend their tongue and wrap a gauze square around the tongue to bidigitally palpate dorsal surface. Using the same gauze, pull and turn the tongue on its side to visually inspect the base and lateral borders. Then, ask the patient to raise their tongue to their palate to visually inspect and digitally palpate the ventral surface of the tongue. While patient has their tongue raised, use a mouth mirror to visually inspect the floor of the mouth. Check the lingual frenum and wipe sublingual and submandibular glands with gauze to assess the salivary flow. Bimanually palpate sublingual and submandibular area by placing index finger intraorally and the fingertips of the other hand extraorally under the chin to feel the tissue. Take intraoral photos of any lesions that are not within normal limits and document all findings in the dental history and chart note. Lastly, turn off the overhead light and return your patient to an upright position.